Excuse me, doctors. I just wanted you to know that I feel demeaned when you make comments about me not being a real man. It implies that if I were a more manly man, I wouldn't be a nurse. And that's not true. I chose to be a nurse, and I'm very good at it. I would like it if you recognized this and treated me with more respect.
Oh, don't be such a woman.
Don't get defensive.
I would like it if you recognized this and treated me with more respect.
So anyway, the x-rays came back, and sure enough, that's where my pen disappeared to.
Don't ignore the complaint.
I would like it if you recognized this and treated me with more respect.
I'm sorry, Nurse Anderson. I didn't realize that my comments had upset you.
I'll try to be more sensitive in the future. Sorry.
A little understanding goes a long way.
Dr. Malhotra?
Yes.
Dr. Sutton asked me to get a CAT scan for Mrs. Martin in room 202, but the patient is refusing the exam. What do you think I should do?
Well, as you know, we can't force a patient to undergo an examination if they don't want to. Now, what I would suggest you do
well,
is...
actually, doctor, that's not always that cut and dried. There are certain circumstances where we can insist on a particular exam or procedure.
Of course, Dr. Sutton, I recognize that extreme situations exist, but under normal circumstances...
You see, doctor, being in medicine sometimes, requires us to make judgment calls that may not conform to the standard playbook.
Yes, having practiced medicine for over a decade, I'm well aware of that. However, as there's no emergency in this case, we should stick with the protocol.
Okay, then how do I handle this?
Just go back in there and calmly impress upon Mrs. Martin the importance of receiving this examination so that we can give her an accurate diagnosis.
I don't know about that. You see, oftentimes patients are not able to understand the complexities of what we do here.
But she needs this exam, and we can't force her to get it.
Well, no, we can't force her.
So, what should I do?
Here's what you do. Go back in and calmly impress upon Mrs. Martin the importance of receiving this exam so that we can make an accurate diagnosis.
What?
That's a great idea. I'll go try that right now.
Are you kidding me? That's exactly what I told him to do.
You see, doctor, in medicine, you have to know the right way to handle your patients.
This kind of thing happens with Dr. Sutton all the time. He treats the other male doctors as equals, and he never interferes with their decisions. But when it comes to the female doctors, it's clear that he doesn't think we're up to his standards. Sure, he'll say that it's for the good of the patient, but how exactly am I not acting in the patient's best interest? Every decision I make is questioned in ways that he would never question the men. It's exhausting. Sometimes I'll try to assert myself a little bit, but when I do, he'll tell me that I'm being too aggressive. And that's just the word that he uses to my face. So I'm sure that behind my back, it's far less polite. I mean, look, if the situation is serious enough, I will push back. But otherwise, it's just easier not to fight it.